many people getting sick? Because as you know, some of the workers are saying the PPEs and the protection, the other protection were brought in too late, and that's how the initial contact happened, started to spread, and then they moved in. Is that your understanding, or what's your take of how this happened?
Well, if they're mass gatherings, when you think about these facilities, there's a lot of people that are co-located. But so it's all about infectious control practices and really working with the facilities to make sure that they're doing everything that they can. But it's also about making sure that the workforce knows that you need to practice social distancing. If somebody in your household is sick, that you're staying home, that you're covering your cough, that you're, mitigating the efforts even in your household as much as you can. Do you have anything to add to that?
No, really nothing to add. I think that just what we're seeing is confirming what we know about the virus, which is that it spreads efficiently and easily in places where people are close together. So meat processing facility, people are working close together, and so I think that what we're learning is confirming, what we've heard in terms of the efficiency of the virus in some of these sort of settings. I think the other thing that we have learned through some of the surveillance testing is that because we're testing an entire workforce, we do find positive cases in people who might not be experiencing symptoms. And so the guidance about staying home when you're ill, that continues to be incredibly important, but that's why social distancing guidance, if you do have to be out, leave only for essential errands. I mean, I think that the other thing that we're understanding is if you can't maintain 6-foot social distancing between other people, then you should be considering the use of PPE, which I understand that these particular businesses that we're working with are working to accommodate for their employees.
And then what about?
I think that's going to her point with some of the surveillance testing that we're doing is that we are seeing the asymptomatic people that are testing positive. So it really helps that narrative too, and goes back to what we've said all along, that we are in substantial spread. So Iowans should think that this is in every community across the state, and they should be practicing what we've asked them to do from the very beginning.
And then what about manufacturing facilities that are not critical to the food supply? Are you going to be thinking about issuing executive orders about how they operate?
No, I didn't. We need manufacturing up and going, and a lot of it is tied to our food processing. When you consider that 31 of the 100 largest food manufacturing and processors are located right here in the state of Iowa, so many of our manufacturers are tied, whether it's a supply chain or tied to the food supply chain, and so it's essential that they're up and going. But as Sarah talked about, they've provided guidance. They're available for calls. They're being proactive, working with businesses. A lot of the businesses have even done some retrofitting to help supply some of the PPE needs for our essential workforce in the state of Iowa. So there are a lot of different ways that individuals and manufacturers and companies are working to help, provide the food supply chain, but as well as provide other supply chains to keep them up and going as well. So everybody just needs to be responsible and practice what they can practice. We've asked them to, if you've got workforce that can work from home, let them do that. Make sure employees know that if they're sick, they need to stay home. Take the proper steps to try to social distance, rotate breaks, do what you can in the facilities to help protect your workforce.
You also mentioned that some businesses have asked for support and surveillance testing. How many, what industries, and are all of those businesses at that 10% threshold?
I don't have the specifics to answer your question specifically about how many people have reached out to support. What I can tell you is that anybody that calls, we answer the phone and we walk them through that, and we will continue to do that. And to the extent, testing supplies have been limited, and so that's the other thing that we have to keep in mind here in terms of our ability to do surveillance testing. We really want to focus it at, you heard me say one of our priorities this week is really looking at long-term care facilities. Visitation has been, kind of closed down at long-term care facilities now for a long time, and yet we're still seeing introduction of the virus in staff. We're seeing that, and we're seeing some outbreaks. And so one of our targeted goals is to use some of those surveillance testing supplies to look at staff of long-term care facilities. And so we'll continue to do that, but there has to be a prioritization. So we're not going to be able to offer surveillance testing services to everybody that asks us for that. So we'll just have to see what the requests are, as well as some of are high priorities like long-term care facilities to make sure that we do everything we can to detect who those carriers might be and to keep them, send them home for a little while so that we don't have an introduction into a long-term care facility that we're trying to avoid.
Rachel, Channel 5.
Hi, Governor. I'm not sure if I understood this incorrectly, but last week you said the state has been inside these meat packing plants recently. Could you give me specific dates that state officials last inspected the plants in Iowa and any documentation about what officials saw in terms of mitigation measures in place? And also, Tyson said they aren't releasing how many employees at each facility have tested positive because of privacy concerns. Do you think people have a right to know how many of their coworkers have the virus, or do you think it's okay for companies to withhold this information?
Well, first of all, there are two different, when you talk about the plant or when you talk about the workforce. So these federal plants that are sending their, the processing meat outside of the state and across the world, that is done through USDA, and they have federal inspectors that are on the site. Many of them are on site daily. So that would be, we can get you the contact information for that, but that is, they are routinely there and inspecting often. And so then we talked about if a worker had a complaint about the facility, a workplace complaint, then that was done through Iowa OSHA. And so they have a process in place where you contact them, and they have inspectors that respond appropriately to all of the complaints that have been filed. So those are two different ways that we approach that. And again, we have been in substantial spreads for quite some time, and so every Iowan should do everything they can to be responsible about leaving the house, about social distancing, about staying home when you can, and really doing everything that we can to protect the most vulnerable Iowans. So as we get the information and through the contact tracing, one of the questions that is asked is, where is your place of employment? It's really important that we know that so we can responsibly do the contact tracing and see what the scope of the exposure has been. And we've released those numbers as we've received them. And so I didn't have the information for today, which would have been yesterday's findings, but we'll have that information when the press release goes out. So it's information that we are sharing, and we have been and will continue to do that moving forward.
We got time for two more questions. We're going to go to Aaron at Lee News.
Thank you, Governor. One of the things that people who know these plants have suggested is, as you noted, it's difficult. There's a lot of people in close proximity working in these places. That one possibility would be slowing down those production or assembly lines and slowing down production as a means to enable those workers to maybe space out a little more. Is that something in your conversations with the companies? Do you know if those companies are considering slowing down those production lines, maybe not producing as much, but giving workers an opportunity to space out a little more, or is that something you're recommending to them as a mitigation effort?
They're actually already doing that, because so most of them aren't at 100% capacity right now, just because they're encouraging people that if they're sick to stay home. And so employees are listening and they're doing that. And then as we start to do some of the surveillance testing, we're getting some sense of what the positive numbers are, doing the contact tracing and figuring out how we need to really keep the healthy workforce up and going, and have the individuals that have been sick quarantined for as long as for the time frame that they need to. So they're already talking about putting petitions in between workers, masks, the face shield. They're segregating the way that they do their breaks, and letting people go even into different areas for meal for their lunch when they break. And so they're doing a lot of things proactively already, because again, they know how important it is to keep the facility up and going, and they know that it's extremely important that they take care of their workforce so that they're healthy and safe, and that they can continue to perform the essential role that they play in making sure that our nation's food supply is secure and moving.
Last question will be Tom at KCCI.
Governor, we're having a little trouble getting the numbers from Tyson, and I think that's been brought up. Do you know if Tyson is basically recording COVID-19 cases, and are they doing that on any kind of OSHA log or OSHA recordable, so there is somewhere where that number is being kept and available for us?
I don't know that. You know, we're capturing that when we go in and do the surveillance testing. We're able to tell the number of positive, the number of negatives. We're able to tell the number of, that have been tested. Again, once a positive test is confirmed, whether it goes through the clinic or through the state hygienic lab or through the other labs, when they follow up with, when public health follows up with the contact tracing, one of the questions that is asked is, where is your place of employment? And so we're able to capture that information as we work through the contact tracing process.
Have all the tests of meat packing plant employees been completed and you're just waiting for results?
So we have tested all of the employees at Columbus Junction and Tyson. We've done all of the employees at National Beef. We still have a few that are out, so we've reported most of them. And actually, we were hoping I'd have that before the press conference, the few that have been left. We just didn't get it in time. And so, but we're hoping we get that in time for when the press release goes out. So we'll have that today, and that'll be the final batch from those two facilities. We've made 1,500 tests available that have been sent to 3 clinics in Waterloo, so that they're just doing it a little bit differently. But we'll be able to, again, collect that information through the contact tracing and be able to provide that information going forward. Okay, thank you.
Once again, you've been watching Governor Kim Reynolds give her daily update to the COVID-19 outbreak here in Iowa. She released the latest numbers as well. You can see those on your screen. 257 new cases for a total of 3,159 positive. So we've broken the 3,000 mark. 4 more deaths reported today for a total of 79 deaths. 214 Iowans are hospitalized. 1,235 have recovered. 25,820 Iowans have been tested. Of course, lots to talk about in today's daily update. We will have all of that covered coming up today at noon. We will see you then.